So if you get the chance to watch a movie Concussion with Will Smith and Alec Baldwin, I'd really recommend it. I saw it last night for the first time. Several years old. I think it was done like in 2011, maybe 10 or something like that. I don't know. I just saw it. Netflix suggested it last night, so I kind of watched it, and it was pretty interesting. I learned a couple new things, even though it's not all scientific. Obviously, it's a movie, but they do represent some facts about concussions that is important to the story. But besides that, so uh, this new AI stuff has have been really helpful for me to get more of an understanding of what a TBI is. So I'll read this, and I asked Google AI. I said, if my head gets hit and I go unconscious, what does that mean? And it says going unconscious after hitting your head means the impact disrupted your brain's reticular activating system, the part of the brain that controls wakefulness. This indicates that a mild traumatic brain injury, concussion, it is a serious warning sign that the brain's normal activity has been temporarily turned off. Think of your brain like gelatin inside a bowl. If you hit the bowl hard, the gelatin shakes and twists inside. When the head is hit, the brain slams against the hard skull, causing a temporary electrical short circuit. Unconsciousness means the injury requires immediate medical attention, evaluation. Call 911 and or go to the nearest emergency room. Now, mind you, my son was 16 months old when this happened, in July and then August. So his baby brain skull was still forming. So it wasn't the normal size yet. So if I'm not mistaken, his skull was either just finishing up, or in his brain, or where they have that soft spot on their head, and as your baby that starts to get hardened. So at 16 months old, it should have already been hardened, but you still have that whole dynamic of knowing how much blood and how much gelatin is in there that that has to be dealt with. So then I asked Google AI. I said infant traumatic brain injury protocol, and it says infant traumatic brain injury protocols prioritize checking the airways, breathing, and circulation, the ABCs. Okay. It says emergency teams. Now mind you, this is emergency teams. The only team here was Team Tess and not Team Josh, and a pediatrician who does not specialize in traumatic brain injury, neurology, or she's just a general practitioner, ordinary pediatrician, nothing special about it. So just the ordinary. So in this response, now mind you, this was in 2003. Google wasn't even around yet. But this is the research that I found trying to bring this to everybody's attention. It says emergency teams focus on keeping the brain supplied with blood, maintaining normal body temperature, and controlling brain swelling. Care is typically provided at a hospital's pediatric intensive care unit for concussions. He was not admitted into pediatric intensive care unit because he wasn't allowed to go to the hospital to find out. Then it goes on to talk about the critical care steps. Medical teams manage severe infant TBI through strict step-by-step targets to prevent further brain damage. So that they just said, I'm going to read the rest, but I wanted to pause for a second because first off, there was no teams, and then there was no more further investigation. Doctor should have known that. That would have been on one of the tests from the doctors growing up. There was a study done in 1969 about TBI protocol and how things were changing from back then. So this doctor would have been very familiar with how to treat, or should have gone through the test if they even took the test. There's a whole protocol that's done that wasn't done for my son. But anyways, it says position head, elevate the head to the bed to 30 degrees to help drain blood from the brain. Keep the head perfectly straight, midline. Intracranial pressure. Monitor the pressure inside the skull with special sensors. If pressure spikes, doctors use hypomodular therapy, like giving strong salt water, to pull fluid away from the swollen brain. Blood pressure. Maintain cerebral perfusion pressure. This is the net pressure granted that drives blood to the brain. To ensure adequate blood flow for young children, this target usually between 45 and 55. We don't know Josh's answer because none of that was happened for him on his behalf. Oxygen and breathing. Prevent hypoxia, which is a dangerous lack of oxygen, by ensuring stable breathing. Doctors may place a breathing tube and use a ventilator to keep carbon dioxide levels to a normal range. This wasn't done for my son. So part of this was pretty important. Then it goes on to say medications and procedures. Seizure prevention. You give anti-seizure medication like levetiracetam because infants have a high risk of seizures after a TBI. It says it right here. Infants have a high risk of seizures after a TBI. Sedation. My son was denied all this care. Sedation uses sedatives or pain relievers to keep the baby calm and comfortable. Agitation increases the brain's need for oxygen. Surgery. If pressure in the head stays dangerously high, which we don't know the answer to, or if there's a heavy bleeding, a surgeon might perform a decompressive craniotomy, removing a piece of the skull temporarily to give the swollen brain room to expand. That was denied him. So I find that this AI has been able to do more for my learning curve for this. And then I asked, after this movie I saw last night, they talked about, I'll just read it. But the movie talked about G-force and how much G-force is to cause a brain to concuss. So this was a football movie, but not really a football movie. But so the question is how much pressure comes up. So I did my search this morning. It says, what is the G-force for minor concussion? A minor or mild concussion generally occurs when the head experiences an impact between 70 Gs and 100 Gs of linear force. A G-force is a unit of measurement that measures acceleration caused by gravity. For context, an amusement park ride might expose you to 3 to 5 Gs. So, there's no strict limit. There's no magic number where a concussion always happens. Some athletes experience 7G hit with no symptoms, while others may get a concussion from far less. Twisting matters more. Rotational or twisting forces to the head are actually more likely to cause a concussion than straight-on hits. And then it says the neck hurts too. Whiplash can happen with just 4.5 Gs, meaning almost all concussions come with a neck injury. So, common symptoms of a mild concussion. So, all of these things that were not investigated by the doctor that the Bucks County wholeheartedly put their faith and trust into. We know that nothing was handled above board, and this is the reason my concern, because of the blasé attitude and forcing outcomes and bullying people into them, is kind of where we got to this point. But the more important thing is go check out concussion. Go see what services did happen and didn't happen based on for my son. And I just really would like to make a public service announcement just to have people be mindful that it's better to call 911 if your child falls and hits a head, neck, brain injury than to move them. So, if I could possibly say that people should be aware to, I understand that she is one of 99.9999999%, because out of the, like I said, the percentage of the 600, 700 people that I've surveyed in the past 15 plus years, not one have ever said call the pediatrician. So I'm almost at 100%. So this case is not about, this case is more about, getting him to help. And then I'm not care about the criminal charges against her. I don't care about that at all. I don't care what she did in the past. I don't care about any of that stuff. My concern is my son. And you can't tell me that my son was treated the proper way. Bucks County cannot force it down my throat like they've been trying to force me. The problem with the authority here is that they kind of think that they want me to listen to what they say and obey what they're saying. And my catch is that they've been trying to force feed and tell me to leave it alone and don't touch it and don't look at it and don't respond to it. But this is my son. So when the authorities tell me not to do something, I'm going to make sure that I absolutely do the opposite of what they tell me to do, because they are not the authorities. The police can't tell me that they did a full investigation when there's no medical workup in my file, which I've asked the detectives to clearly explain to me what kind of medical makeup was done on this profile of this boy, in which case they weren't able to say so. So you have lawyers, judges, making these decisions, because really what a judge is, it's a lawyer with a step above. You have people who are not in the medical field making decisions based on their own theories, instead of having to deal with the actual investigation. That's what detectives get paid for, to investigate. Come to find out that I've done more of the investigation than they have, and I'm pretty concerned. I'm pretty confident in my determination. So I do not accept the authority taking me out of Pennsylvania, locking me up, just to think that they can tell me that what they say is true and then it's not. So I do not accept their outcome. My investigation is 100% complete. I can go forward and then submit all of this to the courts and explain to them line by line, day by day, about what is happening to my son and the reasons why I've been making these videos, so he can get a TBI and have it to know his status. But authority, the nerve of them to come to tell me, an American, that I need to stop trying to talk to my son. The only thing I'm guilty of for the past so many years is trying to be a father to a boy. And that's what I got arrested for. How many fathers do you know get arrested to go say, I'm the dad, I want to be here, I want to raise you, and they get in trouble, you get in jail for that? How many fathers really get to go to jail to try to be a father to a child? Now, that's my story, but that's the fun of it. I mean, the only thing I'm guilty of here is calling my son or trying to say hi, spend your birthday, Christmas, holiday. That's all I've done here. That's what I was arrested for. And I was done so just to shut me up. So here I am, shutting up, telling the story about how their court reporter tried killing my son. Talk to Leo. talk to Corda. Talk to the people before her. Let's talk to the doctors after. Let's get it on.